Thank you.
We've been talking with Dr. John Kelly about
Thanks,
strokes,
Suzanne.
and now joining us is Sue Paul, an occupational therapist certified in geriatrics through the American Occupational Therapy Association, and she works at the Baker Rehab Group in Central Maryland. Welcome, Sue. It's good to have you on the show today. Now, Dr. Kelly, we were just talking about risks for stroke. What can people do to reduce those risks? Because we're going to look at good things now, working out how to get over the event.
Well, of course, many of the things we talked about had to do with lifestyle choices, like weight and lack of activity. So obviously, we need to have a good, healthy diet. In fact, some of the things that Heidi was talking about, those foods, and you were just talking about with foods of color and berries and so forth, activity, regular activity, good sleep. But some of them, like atrial fibrillation, there's not a lot we can do. We need the medical, we need a medical checkup to make sure that our heart rate is correct and right. And if not, then we can get something that will help keep our blood thin so we don't get those clots.
And it's easy to check for atrial fibrillation by just feeling your pulse, and if it's irregular, then that's a really important sign.
Yes, the more prominent types you can find, but I would, you know, there's some, you really need to get a doctor to check.
Oh, yeah.
Don't
sit at
just
home
do it
with
for
an
yourself.
irregular heartbeat.
Right.
Yeah.
And it does tend to run in families, so if you have a history of irregular heart rate beats in your family, you should have that checked out. But, you know, I think that one of the key things is think about what you would do to avoid heart disease and improve circulation, and this is going to, in general, be helpful to avoid risk of stroke.
And a big risk factor is blood pressure, and so you can't tell just by sitting, looking at it, feeling how you feel sitting in the chair, what your blood pressure is. So it's really important to go to your doctor and
know what your blood pressure is.
Know what it is.
Know your cholesterol is.
Yeah.
Right.
Right. Now, Sue, you must see a lot of people who are recovering from things like stroke.
Yes, too many.
Too many.
Too many.
So just walk us through the process from when somebody suffers a stroke. When do they start? When are they able to start rehab? How long does that take?
The whole process?
That whole process. Just tell us about it.
Well, from the first time they have a stroke, they're usually in an acute care setting, and therapy is called in as soon as the patient's medically stable. And our priorities at that time are skin protection, because they're laying in a bed, and you know you don't need a bed sore on top of that.
Right.
We want to get them out of that bed.
And you're not able to move yourself around.
Correct.
In bed,
and your sensation can be impaired, and you wouldn't know that you're having a lot of pressure issues. Another thing is aspiration is a risk at that time. So getting the patient up out of the bed as soon as possible is one of the priorities in that acute phase. Also, teaching the caregivers how to handle somebody who might have a hemiparesis on one side. You know, you don't want to pull on an affected arm, or, you know, and the patient, as they're waking up, tends to be very sleepy and has trouble with alertness. So those first critical days are about getting them up and, you know, awake again.
Right, because you can lose that gag reflex,
And
the
swallow
ability to
reflex.
guard your airway and swallowing and things. So yes, that uprightness is really important. Then when actual rehab starts, when would that actually start, the real hard work?
Well, you know, as soon as they're able to be transferred to some sort of more rehabilitative setting, it would be in a rehab hospital or a subacute nursing facility. Then they start daily therapy, depending on their needs, of physical therapy, occupational therapy, and speech therapy if that's needed as well. Usually twice a day, all day long. I mean, they're getting a lot of intensive work for, you know, maybe a month. I think that's you know, we have limitations in our healthcare system of how long they're able to stay.
And that's a really important point, is the healthcare system can't continue forever.
Right.
And that's why do you involve family during that process?
Oh my gosh, yes, because, you know, figuring out what their post-discharge situation is going to be is part of what we do, and we become, you know, case managers and social workers of, you know, putting together the equipment in the home and who's going to stay with them, and if there's a spouse, or, you know, and they have to go back to work, arranging for outpatient therapy if that's needed, or home health. You know, there are some options.
And how quickly do you see progress in that rehab?
Gosh, everybody, it's such a variable thing, because the stroke can happen in any section of the brain and can cause a variety of different problems. So, you know, initially we see a lot of improvement in those first few weeks, and you have a sense of maybe how things are going to go. So if somebody had a completely flaccid arm when they were first had the stroke, they might get some gross movement back. It's sort of an abnormal pattern. So therapy would work to try to normalize the tone and get the arm moving smoothly, but that can take years to actually accomplish that.
Really? So in fact, rehabilitation should keep going. Have you ever seen someone recover fully, not from just a TIA, the temporary, but a more dense stroke?
You know, for my own patient, no, I haven't, since I don't deal with rehabilitation and with stroke patients. But I do know patients, when I was in training, that definitely I saw have full recovery. But I will say those were the ones that had less severe motor dysfunction or speech, you know, problems. But I know that it is possible for us to have full recovery. But as Sue was saying, it takes years and persistent effort, and our, you know, health insurance, you know, ends after a few weeks. Generally, I don't know of anyone that gets more than a few weeks in the U.S.
Wow.
And so it really requires family or friends and persistence on the part of the patient. We were talking earlier about how comorbidities can really limit that. Because, for example, if someone has a disease that prevents them from exercising, being active, it can be almost impossible to recover because you've got to move. You've got to have activity to have recovery.
Right, good point. Coming up next, we'll show you some practical tips that'll help you in your recovery process after a stroke. Sue's going to show us those. But first, let's take a look at today's medical news report.